Could you please start the role play conversation, Anu? Thank you.
Good morning. My name is Anu. I am one of the registered nurses in this emergency department. May I
Morning.
know you? Good morning. May I know your name, please?
I'm Reena.
Hello, Reena. It's nice to meet you. How can I help you, Reena?
Sister, actually, today morning I went to meet my friend. While walking on the street, unfortunately, I had a dog bite. I don't know what to do with this. I have more pain in my leg.
Oh,
Is there anything else I need to do for that?
I'm really sorry to hear that, Reena. You had a dog bite. I'm here to help you. Before I proceed further, could I know a bit more about the incident? Is that all right with you?
Yes, sister. Actually, today morning, one dog was bite in my in my leg. After the bite, I have more bleeding, but still I have bleeding and painful also.
Okay.
After that, I did not wash anything. Immediately, I rushed to the hospital.
Okay. All right. Thank you so much for explaining this back to me, Reena. Is it all right if I can have a look at first? Is that all right with you?
I, all right, sister.
Okay. Okay, let me have a look at first. All right, Reena. Um, After the examination, it seems like it actually doesn't need any suture, but I need to clean it thoroughly. Is that all right with you?
I'm clear, sister, but why it is not sutured? I told you that I have bleeding also. Maybe the skin was teared, no? So usually if we come to the hospital, there is any break in the skin, usually they used to suture, no? Why? What is the reason, sister, you are not suturing?
Oh, I understand, Reena, your concern. With me, it seems like it's only the superficial cut. That's the reason. It's only need the clean and a small dressing at the moment. Am I clear to you, Reena?
Yes, sister, I'm clear with your suggestion.
Okay, let me do that at first. Then we can just proceed with further management. All right. Uh, what about the tetanus vaccine? Have you ever heard about the vaccine before?
Yes, sister, I have received my vaccines 12 years ago. Recently, I did not take any vaccines.
3 years ago. Is that right?
12 years ago.
12 years ago. Okay, Reena. Reena, it seems like um, it's long time because um, after this dog bite, there are more chance to get tetanus infection, and it is very dangerous. That's the reason I strongly suggest you to take another tetanus vaccine today. What do you think about it?
No, sister, I'm not interested interested to take any injection. I'm scared of injection, sister. It's just only a dog bite. Why injection, sister? No need.
Oh, let me explain you that, Reena. After this dog bite, there are more chance to get the infection through your blood, and it can be quite harmful for your body as well. That's the reason this vaccine is very important at the moment for you, Reena.
Okay, sister. I'm clear with your suggestion. I will take the vaccine.
Okay, thank you so much for listening and understanding me, Reena. Before you go home, can I would like to explain what else you need to look after at home. Is that okay with you?
Okay, sister.
Okay, firstly, it is very important to take the painkiller, and I can prescribe the medication from here. It is very important to take at least every 4 hourly. Is that okay with you?
Okay, sister. Actually, I have more pain. So while you are prescribing the tablets or medicine, you can give me some painkillers also. Is it can be possible, sister?
Yeah, that's I mentioned to you. It's the painkiller that's I can prescribe for you, and it's very important to take painkiller before the pain starts. Then it's going to
Okay.
be help quite a lot. And secondly, it is important to take rest like other injury. Make sure to elevate your legs. Use the pillow or something to elevate your legs. Is that okay with you, Reena?
Okay, sister.
Okay.
I will
Then,
follow all your instructions.
all right. Thank you so much, Reena. As I said it earlier, just continue with your painkiller and make sure to take plenty of rest and elevate your legs. Uh, is any would you like to ask me any other questions?
No, sister.
Okay, I wish you a speedy recovery, Reena, and see you
Thank you.
soon.
Thank you, sister.
All right. I think this conversation was held for about 5 minutes, and both of you guys have done a wonderful job in this role play conversation as well. But I just would like to give you the feedback on the mistakes Anu has committed, and then the suggestions on how to address those issues. All right, let me go through them one by one now. So first of all, you have introduced yourself very well and addressed the patient's concerns politely and appropriately. So I'm very happy with the way you have done these things.
Okay, thank you, sir.
Okay, so you have done a wonderful job. Um, that's the good thing. And then the next thing is that you have used a range of connecting phrases to share the information with the patient. So you have done a wonderful job. So well done on that. And then your voice was polite and soothing. Okay, so you are able to listen to the patient's concerns. Okay, you were able to think from the patient's perspective and carefully listened to her problems. Okay, that's good. I'm happy with that. All right, and the next thing is you also asked the questions to the patient in a polite manner. Well done. So you have done a wonderful job. So as far as the way of providing the reassurance, okay, reassurance was well provided, okay, according to the question made by the patient. So that's good. I'm happy with that. There were a few occasions
Mhm.
where you have committed background noises and hesitations, okay, along with
Okay,
the false starts.
okay,
Yeah. All right, that could have been avoided. But the good thing is that you have reduced the frequency of these mistakes
okay,
dramatically. So that I'm very happy with that. And so those some of the false starts would be like you said, I understand. I understand. Sorry. I understand, Reena, your problem or your concern. This is wrong. So
okay,
what you should have done is, okay, so I understand was repeated twice, and that's what we call the false start. Okay, so this is known as false start. All right. But the
yeah,
second thing is the placement of words. Look at these ones. I understand, Reena, your problem. This is wrong. I
Mm.
understand your problem, Reena. Okay, so
Yes.
your problem has to go in the beginning and then Reena. Otherwise, you can say, Reena, I understand your problem. So you can
Mm.
use the other way around as well. You can also take, hello, Miss Reena, I understand your problems or concerns. Okay. Otherwise, you can say, I understand your problems, Reena. Okay. So when
Okay.
you tell this, there should be a small pause between problems and Reena. Okay.
Okay.
You should
All
say,
right.
for example, I understand your problems, Reena. Okay. All right. You can't just tell them together. You can't say,
Okay.
I understand your problems, Reena. No. I understand your problems, Reena. Okay. All right. Apart from that, you have given a couple of incorrect sentences. You said, I will look at first. Okay. I will look at first. You said the same thing. Look at first. Again, once again. You should
Okay.
say, I will look at it first. Okay.
Okay.
You
All
should
right.
say, let me have a look at it first. Okay. I will look at it first. The dog bite, you have to have a look at it first.
Look
You
at
can't just
it.
simply say, I will look at first. Otherwise, you can say, I will have a look at it first. Okay. Or can I see the dog bite? Okay. Can I see
Yes.
the injury? All right.
Okay.
Can I have a look at the site of injury? Something like that. All
Yeah.
right. Okay. Let me do that again. You said, let me do that at first. This is wrong.
Mm-hmm.
I don't know why you used at here. You should say, let me do that first. That's it. Don't add at unnecessarily.
Mm-hmm.
All right.
Yeah.
And then you said 3 years ago. Am I right? Or is that correct? Yeah, is that right? That's what you said. But you should have said, did you say it was 3 years ago? Okay. Did you
Mm-hmm.
say, not say, sorry. Okay. Did you say it was 3 years ago? Okay. Was that 3 years ago? You can simply say, if you want to keep it really simple,
Yeah.
was that
Was
three
it?
years ago? Yeah,
Oh, yeah.
simple. Keep it really simple. Was that 3 years ago? Only 5 words. That's it.
Okay.
Okay.
All right.
All right. So keep it simple. Otherwise, you will commit mistakes. 3 years ago,
Yeah.
is that right? It's an incomplete sentence. Okay. It's an incorrect sentence. All right.
Yeah.
And then you said there are more chance. Again, that's an issue. You should use there are more chances. Okay. Either the plural noun, or you can say there is a great chance
Mm-hmm.
of something. Okay. Use either this or that. Don't mix them up. Or
Okay.
always go with the plural noun after that. There are
Mm-hmm.
many people. You can't use there is many people. That's wrong. You can't say um, there are one person. That's wrong. Okay. There is one person. There is a doctor. You can't say
Mm-hmm.
there is many doctors. That's wrong. Okay. There is two doctors. That's wrong. All right. Do you understand?
Yes.
And then you said, I would like to suggest you. I would like to suggest you to, and then there is a long pause in between.
Mm-hmm.
There's a long pause, and then you said take. All right, that long pause needs to be avoided. That's not good.
Okay.
And then it's important. The way you have pronounced is incorrect. You have mispronounced it. I think I have told you this in the previous session, isn't it? Some of the words wouldn't be pronounced very well, and this is one among them. It's not important, but it is important. It is
Mm-hmm.
important. All right, pa. It's not b. And then you said, "Thank you for listening and understanding, listening and understanding me." All right, that's wrong. Thank you for listening to me and understanding. Listening goes with the to,
Okay.
always. All
Yeah.
right. And then again, you have mispronounced. It is very important. You said important. Okay. That is actually mispronounced. Right. You could have done a better job, by pronouncing them correctly. And then you have said yeah, yeah, because she asked for the painkillers and you have said yeah, yeah. It's better to say yes. If it is frequently beaten up, then you can use of course, or you can use certainly, okay, or you can use surely.
Okay.
All right, sorry. Of course, certainly, or surely, and so on. Okay. So do not use the informal phrases. Yeah, yeah is not good. Okay. And you said plenty of rest. It's not plenty, but plenty of rest. Okay. Plenty was mispronounced. Right. You should press. You should give more pressure to T. Okay. Plenty of rest. All right.
Okay.
And then in the end you said like would you like to know, you should have
Yeah.
asked is there any question, that's it, finish.
Yeah.
So don't mix them up again, don't give a false start. Okay, you started by saying is and then would you like to ask any other questions. So would you like to ask any other questions. Okay, this is not good. All right, false
Okay.
starts again. Okay, so apart from that, you have shown sympathy throughout the conversation. I'm happy with that. Throughout the conversation. So that's a good thing. And yeah, I think this time the number of mistakes is quite higher than what you have committed in the past. I mean, in the recent one. According to me, this one, all right, let me have a look at it first. You have done a few good things. Okay, they were really fantastic, but there are other areas where you have committed more mistakes. Okay, especially the use of pronunciation, and then the nouns, verbs, tenses, and so on. Some of the sentences are incomplete as well, which is not good. Okay, according to me, this role play conversation stands at 340 out of 500. It's really close to 350. You have done a wonderful job, but the thing is that there are so many mistakes
Okay.
frequently. All right,
Yeah. Yeah.
and as a result I cannot give you 350. I'm not fully convinced to give you 350 for this one. Okay.
Okay. Yeah.
All right, Anu, do you have any questions? Are you happy with my assessment?
No, I don't have any question so far.
Yeah, okay.
It's okay with me.
All right, no worries. So I'll upload this video on YouTube and you can have a look at that. Thank you.
Okay. Thank you.